These are stories of hope and courage from the hospitals and University of Loma Linda. Seven different species of marine turtles grace our ocean waters as they fulfill their role to help maintain a healthy marine environment. Sea turtles are considered to be ecosystem engineers as they keep seagrass beds and coral reefs healthy. Simply put, the turtle's job cannot be replaced. But human activities have tipped the scales against the survival of these ancient mariners. Nearly all species of sea turtles are classified as endangered. Slaughtered for their eggs, meat, skin, and shells, marine turtles suffer from poaching and overexploitation. They also face habitat destruction and accidental capture in fishing gear. It is estimated that only 1 in 1,000 hatchlings make it to the breeding age of 18 to 25 years. But one man is set on saving these endangered species. Dr. Stephen Dunbar, a biology professor at Loma Linda University, is conducting scientific research in Honduras.
So our work is focusing on various aspects of sea turtle research, conservation, and community development. We have no conception of how many turtles are out there.
That's why Dr. Dunbar started his research program in Honduras. By tagging, he's able to begin tracking the turtle population.
At first, when I started, before I started actually putting the tags on, I would practice on cardboard to make sure that it was a good, hard, clean application so that we wouldn't hurt the turtle, or at least hurt them as little as possible. And so I've just been tagging literally hundreds of turtles since then.
Part of his research takes place at the Reef House Resort on Roatan Island, where the resort pays fishermen about $15 for a sea turtle. That's about a day's wage for local community members. The turtles are then kept in a protected tide pool until Dr. Dunbar can tag them and release them back into the ocean. During the nesting season, turtles make their way onto the beach at night to lay their eggs. This is when Dr. Dunbar and his research team can identify new turtles and tag them. But there are many misconceptions among community members that rely on the turtles for food and income.
We're trying to get them so that they allow us to tag the turtles, but we're running into a little bit of problems with them understanding the importance of the tags. ¿Regresa?
No, no regresa.
Sí, exacto. Sí. Es en todo el mundo. Todo el mundo marca las tortugas. He was saying that his idea is that when you put the tags on them that they don't come back. And so we were trying to explain to him that all around the world people are tagging turtles and they're coming back, and that it's very important for understanding the population, the number of turtles in the area. So we have to take some time to explain it to them, and explain it to them both here on the beach as well as in the town and in their homes. We need to talk with them some more.
There's a drastic drop in the number of nesting turtles.
In Honduras, it's essentially illegal to harvest eggs or to take sea turtles. However, there is in the law an allowance for people who are very poor to be able to collect eggs if it's a main source of income. So what's happening is here, especially on the south coast of Honduras, egg harvesting is taking place throughout the majority of the nesting period for sea turtles. He's got 138 there, which is quite a bit. Those eggs are going to local markets, and those eggs are then being sold for an aphrodisiac. Basically, people are breaking the eggs into glasses and adding alcohol and then drinking them as an aphrodisiac. So we're losing a lot of the eggs just for an idea that really doesn't hold much weight.
In addition to his research, the biologist educates the community on the importance of these endangered species.
Things are improving a little bit at a time, but it's slow here because most of the people still don't really understand what we're trying to do with the turtles. So. The older lady was saying that now they are getting maybe 1 or 2, sometimes 3 nests in a night, whereas before, when she was collecting eggs, she herself might get 30 nests in one night. And nowadays they're lucky if they get 2 or 3 nests in a night. So that shows how much the population is potentially has declined. So that's a real concern.
The local myth is that tagging the turtles not only drives them away, but rumor has it that it also attracts sharks.
Okay, we are back, and I have a surprise guest with me, Stephen Dunbar, PhD. Nice. Stephen, PhD, Assistant Professor of Biology at Loma Linda University. I've been here about 6.5 years, and when I first got here, I saw turtles, and I snorkeled with turtles. I'm not really a diver, but I snorkeled with turtles. And over the year or so after that, I stopped seeing turtles. And I don't remember anybody coming back to me and saying that they saw turtles. Tell us a little bit about what you are doing.
Well, here in Roatan, we're doing several things. We're working with the local communities around the area. So we've been going around to the schools on different parts of the island, talking with the children, getting them involved in some conservation projects, as well as carrying out research projects here in Roatan. My name is Steve Dunbar, and some people around here call me Senor Tortuga.
Dr. Dunbar also teaches the young ones about sea turtles by visiting schools around the country.
Right? Touch him? Touch him, don't be afraid.
The goal is to educate the next generation on the importance of marine health. Plans are underway with the local government to develop an ecotourism destination on the southern coast of Honduras.
So it's a viable alternative for poor communities, for communities where we're working on sea turtle conservation, for sustaining the communities, for building up and developing the communities as well.
Oh, I know they've been a little bit stressed while they've been up in the bucket and getting things done to them. And then to just see them take off and they're back in their natural element, it's very enjoyable to see them swim away. This morning we're taking a hawksbill back out to sea. We've had her for a couple of days, and we're going to be releasing her today. She's been tagged, weighed, and measured, and so we're going to take her out.
In the meantime, Dr. Dunbar continues to work with communities throughout coastal Honduras to find answers to the many questions that still exist about how to best preserve sea turtles, and to do that in ways that both benefit humanity and ensure the turtles' continued survival for generations to come.
It's something that I've always fought with, my weight, since I had my daughter, and my daughter's 24 years old, and it's just been a constant battle. And the thing is that when you do diet a lot, you can stop and your lifestyle continues and you go back to doing, the same things, and the weight comes back, and most of the time it comes back more than what you lost prior.
Literally now worldwide, but specifically in the United States, we have one of the most massive epidemics we've ever experienced anywhere, where obesity is increasing at an incredibly fast rate. So now we're kind of, as a national average, 2/3 of all Americans are either overweight or obese.
Both my mom and my dad, I've lost them at pretty early ages due to just different health reasons. I lost my mom in December, cancer related. She was also diabetic, and that was really my turning point, was just watching her over the last summer, starting to just go downhill, and I knew that I needed to make a change very quickly. I've lost over 40 pounds since November, just doing MediFast and being with the Take Shape for Life class.
Take Shape for Life is part of our Center for Health Promotions, where we have our bariatrician, our nutritionist, and our psychologist there. And it's a program that's put on for patients and allows them to meet with the dietitian and establish healthy lifestyles as far as healthy eating, healthy exercise habits.
You know, our old idea was, well, my gosh, you gotta just eat less and exercise more. Well, if that actually worked by itself, there would be no heavy people, would there? So those are the things that are changing so rapidly, where now we're seeing this as a biology that was not adapted to the current environment we're in.
Once you cross a BMI 35, it is extremely hard for people to lose weight on their own. And it's not because they're not a nice person. It's not because they don't have the willpower. It's actually because they're battling physiology that actually kept us alive back in the 1200s, when we didn't know, when our next meal was going to be, or getting us through that long winter.
We were given a biology that was very well adapted to the 1700s and before. So this was all pre-industrial revolution, where physically we had to work very hard. So what we look at today as a problem, for instance, preferring fat, preferring sugar, preferring starches, not wanting to move, not wanting to exercise, all of that would have been very appropriate in the 1700s, because we had to physically work hard, so we wanted to learn how to work efficiently, and when we weren't physically working, we just wanted to sit. I don't care whether you think people have been on this earth for 6,000 years or 6 million years. Either way, 200 years is a very, very short period of time. In that period of time, our bodies, our biology, our brain has not been able to adjust to this new environment, where we literally don't have to do anything physically to find calories. And so when we think of our medical approaches, it's a very radical. We sometimes have to use medication. Sometimes we have to restrict the calories significantly. And one of the radical approaches is to give somebody a stomach as big as my thumb.
May 6th is my surgery, and I had my pre-op today, and my anesthesiologist appointment is today as well, and I'm just waiting for my time, so can't wait for it to be here already. I know going into this that it isn't going to be, a fits all. I mean, it's not going to fix everything. It's something I'm going to have to work on, and something I'm going to have to continue with, the portion control and eating the right things. Knowing that I'm going to be around to play with my grandchildren and go to the amusement parks and, keep up with them with the energy, I think is what I'm most excited for.
Hi.
Hi.
I'm Emily.
Excuse me. Hi, I'm Cindy.
Nice to meet you. I'm going to be your nurse in your room.
Great.
Okay. And your own words, what are we doing for you today? My own words. Giving me a second chance at the rest of my life. Yeah. I'm very excited.
Through small incisions in her abdomen, 85% of Cindy's stomach is removed. Because the surgery is done laparoscopically, Cindy is able to go home only 48 hours after her surgery is completed. A year and a half later, Cindy has lost 110 pounds and has gone from a size 22 to a size 8.
So these are my before pants. They were size 22, and I fit in one leg of these pants now. You know, I've always been a go-getter, but now it's like there's no stopping. It's just, you know, everybody's like, you need to slow down, rest. But it's just, you know, I continue to just go, go, go. You know, one of the most incredible things for a woman is when you're going shopping is to be able to just go pick out a size and put it on and you know it's gonna fit. One of the most discouraging things was going into a store and having to try on every little thing that you put on. And now I can go and I can pick up a size 8 or a size 10 and I know I don't have to try it on. I don't have to go in there and, you know, get discouraged because I know it's gonna not fit me. When you're heavier, people look, they stare, you know, you get those, you can always feel it. And that's changed.
There's still a lot of stigma out there, and even social stigma as far as getting a job, getting promotions. We know that there's bias behind people who have the extra weight. So it's just not right, and it's something that we're here to help those patients with.
I think I'm a lot more optimistic, you know, just endless possibilities about what life can bring me. My grandson is 8, my granddaughter is 6, and they're busy bees, so you know, just knowing that I'm in a much healthier state and able to do and be there for them, it's a new lease on life, and I'm just so excited that I took the journey and that I've succeeded.
Loma Linda University partnered with community organizations to present this story to raise awareness about homeless youth. Just a stone's throw away from a middle-class neighborhood in Redlands, California, homeless teenagers live across the street on the edge of the city.
This is home.
This was my biggest fear. Being homeless, you know, not really having a place to shower, not having a place to eat, not having a bed to sleep on, you know, and now that I am living it, there's really not much to lose anymore. I really don't have anything to fear for.
It's estimated there are approximately 2 million homeless youth in the United States, 30,000 of which are in San Bernardino County.
These kids need help. The kids are victims of circumstances. They didn't choose to be homeless. We try to collaborate as many agencies as we can to try to meet the needs of the kids because, as I said, we're just a school district. We can't do everything. So we really do tap into our community to try and help us with that, meeting the needs of the kids.
John is on the streets because of his girlfriend, Danielle. Danielle's on the street. She went all the way through foster care. She was in the girls' homes. She aged out through foster care. Danielle's mom is homeless on the streets. Obviously, her mom was not able to take care of her. Hey, John, how are you doing? This is Heidi. Good, how are you feeling? Are you still sick? How about Danielle? Do you guys have groceries over there? Or you guys need, I got some grocery certificates. I did. Youth Hope's goal is to take youth off the streets. We want to let the youth know that they do have a soul, that they're worth fighting for, that they are human beings that deserve to be loved unconditionally, no matter what. I only have one rule.
Okay.
You can get one junk food. Only one.
Oh, we're good on junk food right now.
Oh, okay. Everything else is good, healthy stuff, because I need you guys to be healthy. And the other thing is, I need Danielle to get a lot of drinking things, because she has to become a camel for me. Did you tell him about being a camel? No, I
I always tell her drink water. Drink water helps everything.
I know, but we need her to become a camel.
All right.
Do you guys need any bread? So they have over here, it's like 99 cents, which is very cool. When I shop with the kids, my goal is that they pick out what they're going to eat, that they kind of think about breakfast, lunch, and dinner. And again, it needs to be healthy food, no matter where their living conditions are. And, you know, what can you eat? You know, these guys, they don't have a kitchen. They're in a tent. Do you like beef raviolis? Because you guys need to be looking for at least a week's worth of food, okay? Now we can get down here, beef raviolis and tomato sauce, and it's a whole container of it. Ooh, watch your toe, huh? They're individuals, right? Yeah. The other thing for ants, if we get like Ajax or something and you spread it around your tent, they're not supposed to cross the white line.
Yeah.
What does? Salt. Salt? Okay. So we can see what's the cheaper of the two. So we're getting salt to help us with the ant problem and the spider problem. So if we can get those.
I don't know how they'll work with spiders, but I know they work with ants.
Okay. Well, we'll do that. Good, how are you? You guys want paper or plastic?
Plastic, please. My mom and my grandma both did want me to stay. They did. I mean, even though we had a lot of problems, my mom was still active addiction. You know, she was still doing meth. She was a biker chick, you know. She ran with the Hells Angels a lot, so it was like every time I came home, there's some sort of drug or some sort of druggie at the house, you know. So it's just, she still wanted me to stay, but, you know, at the same time, though, I didn't want to stay. I just kind of left, you know, just because I wanted to be with her out in the streets because I didn't want her to be alone.
To be out here, it is hard, you know, especially for girls, you know, when you're on your period or something, you know, and you don't really have a lot of resources you can do, you know, so you have to make it work, you know, bird baths at gas stations, you know, or at the park or whatever, you know, you have to make it work. You know, it's really hard and you really get insecure, you know, you lose a lot of self-respect, you know. I mean, I know I have. We're out here because either we don't have a choice or, you know, like, we feel safer out here. And it's sad that we have to be like this. To be out here, you gotta find somewhere where nobody's gonna mug you. You know, you gotta find somewhere where you're gonna be able to sleep okay at night. We can't really sleep at night, you know. We don't have doors we could lock.
And it's just, people just think, oh, they're low lives, they don't know anything, don't know how to do anything. Like, if you look at my credit transcripts, all you see are A's and B's, A's and B's. We're not stupid people. We're not stupid at all.
Homeless kids do grow up rather fast. They're very mature. They're street smart. They are very smart. They would probably tell you some things and you'd be like, wow. But they have to know the streets. They have to know who they can trust, who they cannot trust. And it's unfortunate that our kids have to grow up living like that, but they do.
My goal in life, I want to be a mortician. I want to go to school for cosmetology and embalming, and I want to do that because I think financially I'll be secure, you know.
I am in the Urban Conservation Corps with forestry and fire protection. So yeah, basically, like, they can call me any time of day if there's a fire or something that needs to be done, like some sort of trail work or there's a fire hazard. They can call me in and I have to be ready, suited and booted within 45 minutes and ready to go.
When we go out on the streets, our kids don't look homeless. Most of them don't. And they don't because they don't want to look homeless. They want to be just like everybody else. They want to have worth. They want to have hope.
But we have resources and stuff like Youth Hope and the churches and Salvation Army and stuff, you know, to help us like eat and stuff, and so.
Youth Hope is very important. You know, it plays a big role in my life as far as, you know, surviving. You know, when you're on the streets, you have nowhere to go. You know, you have no food resources, you have no clothing resources. But you go down there, it looks like a mini Ross and a hometown buffet. Like, you can eat all you want, and all the clothes there are free. They have a bike shop there, they have art studio, and they have basketball and just places where we can hang out at where it's nice and cool. You know, definitely a living resource that helps you live, like literally.
We have Loma Linda Hospital and Loma Linda University that has partnered with us, and our kids don't have to be sick anymore. They are able to be well and to be healthy, which is so important.
Next week, Thursday at 4 o'clock, I have an interview with Del Taco.
At Del Taco, which one?
This one right here by RHS and McDonald's at 4 o'clock, 4 p.m. Like I said, I
Gained a lot out of Youth Hope. You know, I picked up Christianity, I picked up sobriety, and I picked up vision of what's really there. I would have probably still been stuck in that ditch, you know, either in handcuffs or 6 feet under. I don't think there's a thank you that's, you know, powerful enough to use, but, you know, thank you.
There's always a better day. I mean, it may not seem like it at times because it's just like the situation that you're in sucks so bad. There's always a better day. Always.
Thank you for joining us.